Welcome to our Thursday Zoom call. This is Kim Champney with the Health Tie team. We are recording this meeting and the link will be available for people who weren't able to join us today. A few slides to go through and then I'm turning it over to our special guests. So just to remind you, we are, these Thursday calls, let's see, really are an opportunity to connect with each other and find out what's going on with Health Tie. It's every other Thursday, and it's a mix of short presentations, communication, program building. So once a month, we invite an entrepreneur or somebody working in the startup space to share what they're doing with us. And we're very excited today to have Premera's Test Kitchen team with us. And I don't know a lot about them, and we're going to find out together what they've got going on. So I'm going to stop my share, and I believe they have some slides to share with us.
There we go. This is Andrew Smith, Director of Innovation Development here at Premera in the Test Kitchen. I'm here with my colleagues, Kyle, Justin, Hallie, and Patty. We're all from what we call the Test Kitchen at Premera, which is really the focus of our innovation efforts. Premera is, as you know, a health plan that we operate in Washington and Alaska. And we're super excited to talk to you both about the innovation work we do and just to connect with you about Alaska, because we've done a big focus for us has been thinking about how to do innovation within Alaska. Before diving into specifics of what our team has done, I just want to take a moment to talk a little bit about Premera more broadly. 3 or 4 years ago, when Jeff Rowe became CEO, we had a real big shift in both redefining our purpose and our values to be really focused on the customers. And the purpose, which we like to really revisit in everything we're doing, is to improve customers' lives by making healthcare work better, and to really think about how we can make that purpose real. And our values to do this is to put the customer at the center of everything we do. Identify with the customer, to act with urgency, to be excellent, challenge convention, do the right thing, and work together. And this framework of values is a really important foundation for us as we think about new work we can do from an innovation perspective. The Test Kitchen has 3 primary goals. One is to transform and innovate the business. How can we really change healthcare and Premera's participation in that in a meaningful way? Second is to nurture a culture of innovation. We feel very strongly that innovation isn't going to just happen. It needs to be something that permeates the organization, and we have everybody thinking about how to change and improve both the business we're in and healthcare more broadly. And lastly, to build thought leadership and partnerships. One of the key realizations that we've had is that Premera isn't going to do this work alone. It really relies heavily on partnerships of all kinds, whether through its clients and employers or through providers that we work closely with, and as well as the ecosystem of startups that are working on amazing new things and working at a much faster rate than you know, as hard as we push Premera than as Premera is ever going to move. In terms of how we think about doing work, we really like this these 3 concentric circles. And for those in the world of human-centered design, this is going to be very familiar. But really thinking about the intersection of people, business, and technology. This is even baked into how we've structured the innovation team itself. So for people, we have design strategists like Justin here. For the business, we have what outside of healthcare would be called product managers, not insurance product managers, but sort of modern digital or otherwise product managers. And Kyle and Hallie represent that. And technology, we have engineers who are part of the team, and we feel like bringing these three forces together really allows us to be successful. With that, I think I'll jump straight into a little discussion of the work the work we're doing, what we have done, and what we've got on the docket for the rest of this year and moving forward. One area that we've invested quite a bit of time and thought and money into is around predictive analytics. For a couple of years now, we've been partnering with a startup out of the Bay Area called Cardinal Analytics, and working through use cases where we can use predictive analytics and advanced machine learning to identify high-risk members within our populations, and pairing that with programs to do outreach to really help those members. One of the algorithms is around cost bloomers. So people who go from really not showing up on a radar at all to really high cost members from just a claims perspective. And what's really underlying that is when you go and reach out to these members, it's clear they have things going on, and there are opportunities to really help them before those problems become acute. Another area of focus has really been about, based on the realization that changing healthcare is almost impossible to do from one perspective alone, from the health plan's perspective alone. That so much of the healthcare experience and the entire structure is driven at the point of care. And Premera's best opportunity for improving the member and patient experience is to partner very closely with provider systems. And we had a fairly large initiative over the past 12 or 18 months, partnering with a local system here in Washington to build both a product and a care delivery model that tried to identify ways that we could deliver a much better member experience and also provide cost-saving opportunities for customers. And that has proved to be incredibly rewarding, not only because of the product we were able to deliver, but because of a greater understanding of the challenges on both sides, from the system perspective as well as from Premera's perspective. Related to that, as I mentioned earlier, when we looked at kind of that human-centered design basic framework, we are a very strong believer that, no matter how sharp we get our pencils to write really great insurance products, real change is going to come by listening to members and building more effective customer experiences. And so that has been a great focus. And in those partnerships I just mentioned, like Peak Care, the partnership we did with the system, we're able to really start to look at some of those new customer experiences that we can introduce. In that case, we looked at ways that we could reduce barriers to access to care by doing things like offering valet parking or Uber or Lyft rides to get to, for people to get to their appointments that might have trouble otherwise getting there. Improvements to just your everyday problems, like sitting in the waiting room. Wouldn't it be nice to have notification that there was going to be a long wait time? And the basics of interacting with the care system, like checking in, providing your insurance ID, and scheduling appointments and things like that. Another area that we've really been digging into with a close partnership with a startup is around high value care. And this is something that we were really excited about as a pilot that we ran in Alaska and was very successful. And Premera Pulse, which is powered by our partner Vim, is really focused on one hand member engagement and getting people engaged with their healthcare and their care plan. And on the other, providing tools to providers to help them make really good referrals. One of the things that Premera is very conscious of is the amount of variability in care delivery. We see really clearly that the same care can be delivered by two different providers, blocks away, and be of very different quality and cost. and not the cost and quality not really in proportion. So these tools help providers identify those really high quality and high value providers and help members get scheduled with them. We ran this pilot in Alaska for about 12 months, and based on sort of continuous iteration, really felt strong about the how effective it was, and then brought it down to Washington and rolled it across the state later in 2018. And almost getting to the end of these, and then we can we can maybe open it up for some questions. Another area that we've actually invested quite a bit of in from an innovation perspective and now from an enterprise perspective is in AI and chatbots. We've worked closely with Microsoft on their HealthBot and chatbot frameworks, building out a capability to help members navigate their benefits, which can be quite confusing, and sort of an easy to use and simple experience. This has been a sort of an interesting process because while chatbots are quite common across other industries, there's still a lot of both the challenges and the opportunities that the technology offered. And now we have an entire team that's focused on building out the capabilities of this chatbot. Similar to the chatbots, but focused on the delivery of care, we're really excited about the potential of lowering the barrier to access through virtual care. And in particular, making it easy for people to satisfy their healthcare needs through chat-based interfaces and interactions. And this is one where we're not quite to market yet, but really close, as Hallie can attest. And we're actually doing our first pilot in Alaska coming up this summer, where we're making available the ability to connect with a doctor, and specifically an ER doctor, within 90 seconds to be able to talk through health issues that you might have. And that person, unlike a nurse line, is able to fully resolve that issue, even prescribe medications or make referrals. And we're super excited to bring that to Alaska and to really see how effective it is at sort of solving these problems. Another pilot that we're currently running, and Kyle to my left is lead on this, is around second opinions or expert medical guidance. In March, we launched a pilot that allows members in Alaska to get access to the sort of leading experts in a few specific condition types in the country to get a second opinion that might be really hard to access locally. And this is giving us a great chance to see what providing that offering digitally can do to help improve the member experience. And lastly, from the things that are kind of on our plate that we're actively working on, we're thinking a lot about financial health. As we've gone out and talked to members, what we understand is that the financial component of healthcare is so dominant and such a big part of the problems to solve for us. And while this is a really broad theme, we're looking if we can make do some short-term experiments around how we can make, just as an example, EOBs that you get from your insurance company that say, this is not a bill, and then you get a statement that doesn't match that from your provider, how we can address the confusion and the problems with that sort of very basic scenario. And we hope to have experiments in market by the end of the year that really give us some feedback on if we're on the right track or not. I'd actually like to throw it over to Patty to talk a little bit about some of the work we're doing, some additional work we're doing.
Hi, I don't know. Do I need to give them? Hi, I'm
No
Pat.
camera.
Is there a camera there?
No.
Oh, I thought it was off. So. Hi, I'm Patty Brook, another Director of Innovation here in the Premera Test Kitchen. And just kind of like at a broad kind of landscape picture, just to kind of reinforce, Alaska is a really key market for Premera, and it's also a super interesting market for us to engage with in terms of rolling out some pilot ideas that address solutions that we're working on that Andrew went through a lot of, that kind of at a high level address the costs of healthcare and try to develop digital solutions for some of the cost drivers in healthcare. And Alaska's been a great market for us to experiment. We found a lot of great engagement from our partners in Alaska. And I'm super excited about connecting in with this group and others in the Anchorage startup community. I lived in Anchorage for a couple of years, so I understand that it's nice to kind of connect with the outside every once in a while. And I'm, from this point of view, really excited that there's a community of people that are in Anchorage and broadly in Alaska to partner with. So with that said, out of the test kitchen, we have a few different initiatives, and part of my role is to connect with external parties to partner with and find some opportunities to work together and test different solutions and come up with new ideas. At Premera, part of our challenge out of the test kitchen is to create a culture of innovation with employees. So some of that involves bringing outside thinking in. It's to create opportunities for the employees here to engage in new ways of thinking and kind of just think out of the box through what other industries are doing or what other startups in our space are doing, or even what one another is doing across the employee group. Sometimes we can facilitate employees connecting with one another to create new ideas. We do a lot of pilots, and Andrew walked through a lot of those that we're doing. And we will, we develop some training programs for Premera employees. One of the innovation tools that we've developed at Premera is crowdsourcing, and we're looking, so we've rolled that out enterprise-wide at Premera. We're also looking at some opportunities to partner with external entities, and that might be one area to explore with people in Seattle or in Anchorage and Alaska to figure out how we could do a joint crowdsourcing initiative together, which worked really well here internally, enterprise-wide. And then just like kind of through what we're doing here, Justin's been fantastic in kind of reaching out to you all and other entities around our region here in Seattle to really foster connections with startup community. We have most of you are probably aware of GeekWire, the tech publication, tech media outlet here in Seattle area. So we're connected into them and other groups that we are exploring ideas and how to work, and kind of running joint hackathons is one idea that we hope to do this year. And we're also going to be the host for a conference that across the Blue Cross Blue Shield plans that will attract kind of digital oriented people to Seattle to engage in a conference called AI in Healthcare. So those are kind of some initiatives, and I'll hand it back over to Andrew and Justin, but I'm happy to answer any questions too.
Yeah,
Thanks.
actually, I think that's about what we wanted to run through. I think this is just to highlight what Patty mentioned, that Alaska is a hugely important and also super interesting and unique market for Premera, and we're just really excited to connect. Before finishing, just one other element of the test kitchen I'm realizing we didn't talk too much about is we also have a strategic investments component of the team where Premera has carved off a pretty good chunk of change to invest in startups, and we really like to take a very partner-centric approach to our investments as well. So many of the partners that I mentioned earlier that we're doing work with are also companies that we've invested in, and it really helps us give a perspective on all of the exciting stuff that's happening within the ecosystem.
Mm-hmm. And I guess I would also add that out of our crowdsourcing challenge that we ran last year across the company, one of the winning ideas was to produce what we call baby boxes for the rural population, kind of to address infant mortality and engage early for kind of providing education materials and physical items to families that are in remote areas and have harder access to care. So that idea is in development, and kind of maybe just throwing it out there as kind of an idea to think with us about how the implementation would work. Those are the kind of ideas we, facilitate kind of conceiving with our employees, and then working with the employees to develop those ideas and execute. So
thank you so much. This is Kim, and that was an excellent presentation. I appreciated the examples of the kinds of things that you guys are doing. I'd like to start off with a question, and then I'll open it up to other people may have some too. I'm curious, so your health tech partners, some of those companies that you're working with, were they involved in pilots or some sort of test bed activity prior to engaging with you? How far along, I guess, were they in their startup process?
I think a number of them, we were quite early with them prior to investing, and connected with as design partners, where I think it was recognized on both sides where the company may not have fully formed its product yet or found exact market fit, but had really great ideas and great people. And we may have had a problem that was not fully yet fully articulated, or a need that was like as clear and crisp as maybe we would have wanted. And together we were able to make both sides better in the process. And yeah, that's been a really important part of what we found successful.
Okay. Are there other questions that people may have?
Yeah, actually, hi, this is Gloria Burnett. I'm the director of the Alaska Center for Rural Health here at UAA and Alaska's AHUC program, where we have a focus on rural and underserved health workforce development. And one of the things that we do, I'm really excited, thank you for sharing everything that you guys are doing. I was unaware of all of it. And what we do here with students that are in health programs through the College of Health is we try to get them experiences out in the community, completing community-based experiential learning, especially with rural or underserved populations. We're in the startup of our first year piloting an AHEC Scholars program, where we send students that are in health programs out into the rural communities or underserved, working specifically with underserved populations. And I see a lot of overlap in some types of experiences that you guys are looking to kind of pilot or get assistance with. A lot of the time getting boots on the ground is difficult when everyone's busy, but when we have students, those experiences are really transformative for them and can kind of gear where they want to go and what they want to do. I also know, because I spent a lot of time working in and living in rural Alaska, that a lot of those experiences that we have here in urban centers like Anchorage or Fairbanks are not readily available to our rural sites. So we have been working a lot with the state of Alaska Public Health Nursing and our rural critical access hospitals to provide these community-based learning opportunities for our students. And the way we're kind of doing that is by showing the communities that this is not only an area of exposure for the students to transform them, but it's also an opportunity for you to recruit potential providers to come back to your community and work. And the kinds of research and support that the students can provide to some of these initiatives that you have going on are just invaluable. So I would love to talk with you all more as you have different kinds of things that you're working on and piloting, and that if you kind of come to a point where you wish you had some boots on the ground, you wish you had folks in certain communities, we can help kind of staff those types of opportunities with students. And it's a multifaceted synergistic benefit to both your projects that you're trying to implement and get research on.
That's really fantastic.
So I would love to talk more about what potential overlap there might be and how we can help our students find some fruitful experiences that will also transform the healthcare system, is what you're doing, really, potentially.
A lot of nodding heads here.
Definitely. That'd be
Yeah,
great.
and we work with, our target is we are a federally funded program. So we have a target of 90 AHEC scholars per year that we have to output. We're in our first year now. So next year we'll have potentially 180 students that we could use to help us get these things out and implemented. So we're really looking right now for projects.
And I think even
Go ahead.
Oh, I was just going to say, in addition to, like, I think we can immediately think of sort of alignment with the important part of making sure that we're understanding these different communities. And that really does take research and boots on the ground. And so that having that as a channel just to pull that information back in, not only push out pilots, but collect information is incredibly exciting.
Yeah,
Yep.
absolutely.
Thank you. This is Kim, and we have 2 minutes. So is there maybe one more question we have time for? Anyone?
Yes, if I got a quick question.
Yeah.
What would you? This is Ross Johnston, and this is my little baby Saoirse. Very relevant discussion for her. What would be? Would you guys be interested in doing like maybe a startup weekend specifically focused on health, or an innovation sprint focused on health, and like helping to be like a co-lead in that?
Mhm.
And a major sponsor to help kind of if there are boots on the ground here to help.
Yeah, I think it's really interesting. We love the idea of like a design sprint kind of format and having the right participants. Or we've also had experience with like startup weekends that are focused on particular themes. I think that's an incredible way to really bring different perspectives together, and it's also incredibly productive. So
yes, the answer is yes.
Great. That's great. We're at time. I feel like this is the beginning of a really great relationship with our group. I think we have a very diverse group that, like Lori was sharing, and Ross's idea from the startup community, and a number of other initiatives we have that is really relevant. So I appreciate your time. And do you have any final something to share, Premera team, before we sign out?
It would just, again, be great to continue the conversation. So we'll make sure to get you our contact information, and we're excited to keep talking.
Yeah, and I think we're scoping out a trip up there
Yeah.
so that we could have kind of more in-depth conversations about some of these topics. The idea of working with students out in the rural areas, partnering on an initiative, it's just really exciting. Just engaging on some of the ideation and design sprints is super exciting. So I think there's a lot. Yes, I agree. The beginning of great things to come.
That's great. Well, thank you. That concludes our chat today. The recording will be made available to our Health Tide community, and we look forward to your trip to Anchorage, to Alaska, and we'll pull people together and we can brainstorm and come up with exciting things.
Awesome. Thanks, you guys.
Thank you.
All right. Thank you. Bye.
Thanks so much.
Thanks. Bye.